What do you think about Canadian provinces copying a healthcare policy from Europe known as the Cross Border Directive? Before I explain the European policy, think about what often happens while patients wait for surgery in Canada. Imagine Joan, a patient living in Winnipeg. She was told she would have to wait a year for hip surgery. In the meantime, she has chronic pain. She can't work and is worried about what will happen to her body if she takes painkillers for a year. She struggles with walking around her home, and she can't babysit her young grandkids as they move around too quickly. Next year, when the government provides Joan with surgery at a government-run hospital, it will cost $20,000. This covers the cost of surgeon's time, nurse's time, materials, as well as the cost of the facility. Patients in the European Union have another option. They don't have to spend a year waiting in pain like Joan does. An EU patient can wait for surgery locally or go to another EU country, pay for surgery, and then be reimbursed by their home country. Reimbursements cover up to the same cost the patient's home country would have spent to provide surgery locally. If Canada copied this policy, how could it help a patient like Joan? Well, remember, in Manitoba, the government would have spent $20,000 next year for Joan's surgery. Instead of losing a year of her life, she decides to pay for surgery at a private clinic in Calgary. And let's say it costs $20,000 there. Joan would pay the bill and then be reimbursed $20,000 by the Manitoba government. Alternatively, maybe Joan decides on a clinic in North Dakota and it costs, say, $25,000. The government would give Joan $20,000 and she would pay $5,000. But perhaps Joan finds a clinic in Iowa that only charges $18,000. Well, she would pay the $18,000 for surgery and the government would reimburse her for that amount instead of $20,000. This way, the government actually saves a bit of money. Now, these are made-up numbers, but you can see how the policy works and how it could help provide immediate relief for patients instead of making them wait a year in chronic pain. As you can see, this policy doesn't really cost the government a lot more in terms of money. Instead of paying, say, $20,000 to provide a patient with surgery next year, the government pays $20,000 or less this year. There are a couple things to consider. First, governments already do this in Canada, but it tends to be on a much more limited basis than what we see in the European Union. In Canada, it tends to be for more obscure surgeries, rather than common procedures like knee and hip operations. Second, Canadian patients could be allowed to travel not just to the United States, but to Europe and other developed nations. For example, the CBC reported on Max Johnson, a Manitoba patient who paid for private knee surgery in Lithuania. He calculated that the cost of his successful surgery was about $7,000 less than what it would have cost the Manitoba government to provide it locally. Third, this policy would even help patients who decide not to travel for surgery. Every time someone ahead of them in line did decide to travel for surgery, then the patient who remained would get to move up a spot on the waiting list. To be clear, this policy is not a perfect solution, but we can't forget the healthcare system is in a crisis right now, and this policy would actually help a lot of patients immediately. When we polled Canadians on this idea, 72% indicated that they like it, and they thought provincial governments in Canada should copy it. So what do you think? Let us know in the comments section below. And to learn more about this idea, please visit secondstreet.org. And don't forget to hit the subscribe button.